All right, hi Jordan. I'm going to be your nurse practitioner today. Can you tell me what brings you to the office today?
Just the physical.
Okay, and we did your vision test already on the Snellen chart out in the hall. So now I'm just going to gather your vital signs. I'm going to put this on your tongue for a minute. Can you hold it for me for a second? I'm going to gather everything else that I need. Good. 97.9, so that's good. You put this on your finger, check your oxygen saturation. So your vision test was 20/20 vision, that was good. And your oxygen saturation is 98%. All right, just gonna grab your blood pressure. Since we didn't have a hospital gown, we put on a shirt backwards so I can listen to your lungs after, okay? Let's see, put your arm upright. Just let it flop, I'll hold it, I'll support it. Blood pressure is stuck there, got that? Okay, 10/70. Can you tell me your date of birth?
September 17th, 2003.
Good, and what day is it?
Sunday.
Yeah, that's okay. You are correct. Okay, I'm just going to start with a brief physical assessment, okay? First, I'm just going to palpate your head and look for any abnormalities or lesions. Probably would be better if you had your hair down, but that's okay. I can still pretty well feel. Any pain or tenderness?
Nope.
Okay. I feel abnormalities in the ears, but those are just consistent with ear piercings, little bumps. I'm just going to palpate your neck. I don't feel any swollen lymph nodes. I'm going to palpate the trachea. Can you swallow for me? Good. That's midline. Just going to feel your carotid pulse. I'm going to feel your carotid pulse and feel your radial pulse. Okay, are regular and equal. Okay. That's good. Okay, and since I didn't have the otoscope, I did get to use an otoscope in the hospital the other day, but I wasn't able to take it home with me, so I'm going to use the flashlight on your phone that we talked about, just so I can look in your ears. And I'm just going to gently pull down and away. And this really, really bright light, you actually can visualize the tympanic membrane, even without an otoscope. And it's nice and pink and supple, and I don't see any wax, so that's good. Let me just look the other side. Let me pull back a little far since I don't have the otoscope. It looks good. Okay, now I'm just gonna look up your nasal passages, which are good. Septum is equal. Okay, now I'm just gonna have you look right at me, and I'm gonna shine the light in your eyes to assess your pupils, okay? It is reactive. It is bright. Just stay looking straight at me. It is bright. They're equal and reactive though, so that's good. All right, we can turn that off. All right, now I'm just going to test your visual acuity. I'm going to put my hand up. When my hand comes down, you continue looking straight at me. You're going to tell me when you can see in your field of vision my fingers, okay? No, just say okay. Okay.
What?
Just say okay when you see my fingers come into your field of vision.
Okay. Okay. Okay.
One more time over here.
Okay.
Okay, good. Okay, now I'm just going to have you close your eyes for a moment and test your olfactory nerves, cranial nerve number 1. I just want you to tell me what the smell is.
7.
Good. Olfactory nerves are intact. Very good. Okay, now I'm just going to have you hold my hands, and I want you to squeeze, release. Okay, very good. All right, now I'm just going to listen to your lung sounds, okay? All right, I have the open shirt, so this is good. Take a deep breath in and out.
It's cold.
Oh, I'm sorry. In and out, okay. Try to warm it up for you. Okay, another in and out. side? Okay, thank you. All right, I'm gonna have you lay down now, put your feet out straight. Okay, good, good. Now I'm just gonna listen to your lungs in the front. You're gonna take a deep breath in and out. And out. Good. Another deep breath in and out. Okay. Now I just want you to put your hands along your side and breathe normal. I'm gonna listen to your heart sounds, okay? All right. Let's start with the pulmonic. Second pulmonic. Tricuspid and mitral heart sounds. Good, clean gallop, no murmurs heard. Good. Okay, now I'm just going to listen to your bowel sounds. First I'm just going to look at and visualize your abdomen. Okay. Hair is equal. I'm just going to listen for bowel sounds. Just breathe regularly. Actually, just put that under. That was right on your elastic, so that would dampen the sound. Good. Good. Active bowel sounds times 4. All right. So stay sitting. I'm just going to assess your foot strength. Okay. I'm going to push up on your feet. You push back on me. Push, 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 push. Good, good, good. Okay. All right. That's good. Okay. All right. I'm just here. You can sit up again now. All right. I'm just going to test some range of motion. Just put your hands out. Put them up. Supinate, pronate. Okay. Now I'm just going to feel your arm and check your joints. Do some range of motion. Lift your arm up and down. Okay. Any pain or tenderness? I don't feel any swelling. Okay. I'm going to try with this one. Lift your arm up. Good. Okay. Put it down. Okay. Good. Okay. I'm just going to test your temporal mandibular joint. I want you to open and close. Open and close. Good. No clicking or knocking heard. Any pain or tenderness? No. Okay, good. Okay. All right. Now I want to check for inguinal hernia or any lymph nodes. So lay back down again. Okay. I just want to palpate your lower abdomen, pubic area. Do you feel any pain, tenderness, swelling?
No.
I don't feel any nodes present. That's good. I know this is kind of a tickly assessment at times, so that's okay if it feels a little uncomfortable. That's okay. Okay. Okay, you can sit back up. During my assessment too, I did a visual. When you came into the room, I assessed the gait, which was equal and steady. Like I said earlier, hair distribution is equal. I noticed that she sat down appropriately. All of her assessments of my visual, just observations of her, were intact. And are there any other questions that you have today? Okay. All right, I just want to do one more thing. I want to have you stand up and I'm just going to check your balance, okay? I just want you to close your eyes, and when your arms, don't close your eyes yet, but I'm going to have you just touch your finger to your nose and then touch your other arm finger to your nose with your eyes closed, okay? So close your eyes. Take your right arm and touch your nose, and your left arm and touch your nose. Good, okay. All right, you can put your arms down. All right, now I'm just going to check your shoulders. Can you just shrug your shoulders up and down and up and down? Okay, good, good. Sit back down. I'm going to check some reflexes, okay? I'm going to take my hammer here, and I'm just going to have you dangle your legs, okay? And I'm just going to check your popliteal. I did too hard. I'm going to check this one. Okay, and I'm going to check your Achilles. I'm going to check your Achilles reflex. Okay. Any other Achilles reflex? Good, good. Good. Those reflexes are all very well intact, okay? And a very important assessment is I really just want to take a visual of the balls of your feet. Okay, just look for skin, see if there's any abnormalities. All right. So you obviously have good sensation of your feet, which is very important. Oh, let's do your Babinski. Yep, let's do your other Babinski. Yep. Calvia reflexes are definitely intact, okay? And like I said, the visual assessment that we did earlier was intact. She does have 20/20 vision. We reviewed menses, we reviewed bowel status, we reviewed dietary intake. All of those assessments were very appropriate. So if there's anything else that you have today for questions?
No.
Okay, good. That includes the extent of our assessment, and we will definitely review for any immunizations that need to be given today.